If you're a mental health professional, you already know the deal. You love the work you do with clients, but man, the documentation, it can feel like a whole separate job. You're trying to provide amazing care, but you're also worried about getting notes done on time and whether they'd actually hold up in an audit. Well, in this explainer, we're going to show you how to conquer that mountain and turn your notes from a chore into a clinical superpower.
I mean, really think about it, does it? For so many of us, the answer is a big yes. It's one of the top complaints in our field. But what if we could change how we think about it? What if we could shift documentation from being this thing we have to do to a tool that actually makes us better clinicians? That's exactly what we're going to get into. So let's just start by calling it what it is, the documentation dilemma. Yeah, on one hand, notes can feel like a total burden. But on the other hand, they are, without a doubt, your best tool for providing consistent, high-quality care. And this is a big and, they're your number one line of defense when it comes to managing risk. It's all about finding that sweet spot. Okay, so to get really good at this, we have to go back to basics. We're going to get super clear on what a progress note really is and why it's such a heavyweight in your practice. A progress note isn't just a quick reminder for you, no way. It is the official clinical record of a client's care. And here's the part that really matters. It's a legal document. It becomes a permanent piece of that person's medical history. And once you really let that sink in, it kind of changes how you approach writing them, doesn't it? Now, this right here is probably one of the most critical distinctions you need to know. Progress notes versus psychotherapy notes. Think of progress notes as the official story of treatment. They're part of the client's chart, and they can be accessed by the client, other doctors, and insurance companies. Psychotherapy notes, though, those are your private thoughts, your hunches, your what-ifs. They're kept completely separate and have way stronger HIPAA protection. So the number one rule is do not ever mix them. The second you put official info into your private notes, they risk being reclassified as progress notes. Keep that wall up. All right, so you get what a progress note is. The next big question is, how do you actually write one? There are a few different ways to structure them, but in behavioral health, there are really three main formats that you're going to see over and over again. First up, the old classic, the SOAP note. This one comes from the medical world, which makes it awesome if you're working on a team with doctors and nurses. It's an acronym: subjective, what the client tells you; objective, what you see and observe; assessment, your clinical judgment; and plan, where you're headed next. And here's a super simple example. S, the client's words; O, your observation; A, your clinical takeaway from S and O; and P, the action step. See? It's really logical. Everything flows right into the next part. Super comprehensive. Next up, we've got DAP notes. Now, this one is a huge favorite in busy clinics, and for good reason. It's efficient. It basically takes the S and the O from the SOAP note and combines them into one data section. It just saves you a little bit of time, which we all know is precious. You can see it right here. The data section has what the client said, their 8 out of 10 anxiety, and what you saw, the fidgeting. It's all in one place. It's just a more streamlined way to get to the assessment and the plan. And finally, there are burp notes. Now, the superpower of this format is showing medical necessity, which makes insurance companies happy. It's all about drawing a clear line from your intervention to how the client responded. It stands for behavior, intervention, response, and plan. Just look at this example. How the client showed up. I, what you did. R, how the client reacted to what you did. This creates what we call a golden thread that anyone can follow. It proves your work is targeted and making a difference. Okay, picking a format is one thing, but writing a great note, a note that's truly compliant and helpful, that takes skill. So let's talk about the best practices that really separate the good notes from the great ones. Here are 5 things you just gotta do. First, get your notes done within 24 to 48 hours. Seriously, your memory is not as good as you think it is. Second, be objective. Describe behaviors, don't just label them. Third, every single note has to tie back to the client's treatment plan. Fourth, show what you did and how the client responded. And last, but definitely not least, use person-first language. Look, in 2026, this isn't just a nice idea, it's the standard of care. Our words matter. We say a person with schizophrenia, not a schizophrenic. It's a small change in language that makes a huge difference in respecting our client's humanity. So now that we know what to do, let's flip it and look at what not to do. Because honestly, avoiding the common pitfalls is just as important for protecting your clients and, let's be real, protecting your license. Here are 4 of the big ones. First, those vague, useless notes like, client is doing well. That's an instant red flag in an audit. Second, forgetting to document a risk assessment if a client even hints at self-harm. That is a massive liability. Third, judgmental words like manipulative. Just don't. Describe the behavior, not your judgment of it. And finally, every note needs a plan. It shows that treatment is alive and moving forward.
I really want this quote to sink in. If it's not documented, it didn't happen. This is basically the mantra of the legal and compliance world. From an auditor's point of view, or a court's, if it's not in the chart, you didn't do it. Plain and simple. Your notes are your proof.
Okay, so we've got formats, best practices, mistakes to avoid. I know what you might be thinking. This is a lot to juggle for every single client every single day. It can feel totally overwhelming. So how on earth do you make this manageable? Well, for most modern practices, the answer really is technology, and specifically a behavioral health EHR, or an electronic health record that is built from the ground up to handle our unique needs. See, an EHR designed for mental health, like Behave Health, isn't just a fancy word processor. It has compliant templates for SOAP, DAP, and BERP notes already built in. It guides you, making sure you don't miss the critical stuff, which saves you an incredible amount of time and stress. And these systems are setting the stage for things like AI-assisted notes, which will help you spend even more time with clients and less time on paperwork. So let's just boil it all down. What's the main takeaway? Quality progress notes are timely, they're objective, they're tied to goals, and they're person-centered. Simple as that. They're your absolute best defense in an audit, sure, but more than that, they're a core part of providing truly great clinical care. So if you want to go even deeper on all of this, we've got a complete guide to progress notes you can read. And if you're just done with the documentation headache and you want to see how an EHR can totally change your practice, go ahead and look a demo of Behave Health. We've got the links for both of those down in the description for you. I'll leave you with this one last question to think about. Right now, in your practice, is your documentation a powerful clinical tool that actually helps you provide better care? Or is it just a chore you have to get through? Our goal is to make it the first one. Thanks so much for watching.